Okay, Medicare Mark here. Actually, Mark Lumia, aka Medicare Mark. Today we're going to tell you how Medicare Mark helps you get clear solutions to your Medicare questions. You're turning 65, you do have Medicare choices. This card over here is the old card, and some people might still have that old card, but you also were probably mailed a new card starting in April 2018. So those new to Medicare should be getting this card over here on the right, the new card. Let me hide this down here. And I'm going to move on to the next slide. Okay, what we will cover today, original Medicare. There are 4 parts of original Medicare. You basically have 2 choices. You can get a Medicare supplement or a Medicare Advantage plan. We're going to talk about what Medicare covers, what is a Medicare supplement plan and how to compare them, what is a Medicare Advantage plan and how to compare them, Part D prescription drug plans, and important enrollment dates. A little bit about me. I was born in Trenton, New Jersey. I was raised in Fort Lauderdale, Florida. I was born in 1966 and I moved to Fort Lauderdale, Florida in 1972. Currently, I live in Ocala, Florida. Moved up here in 2005. I have an office near the Villages of Florida. It's actually Oxford, Florida. I'm married and I have 4 children. I'm 53 years old and my children are 3, 6, 8, going to be 9, and 12. I've been licensed since around 1989, and I've been an independent broker since around 1994. So here are a few benefits that I offer. I give you non-biased information or opinions. We hold Medicare focus groups, and those are designed to answer the questions you want answered, not the questions I think you want answered. So we do a Medicare focus group where we ask people questions about what they want to know when they're turning 65, when they're getting on Medicare, and they tell us that, and later we come back and produce a webinar or seminar and answer the questions that the people raised. And we're going to review your coverage every year. Our clients come in every year, or we get on the phone with them. Some of them just say, hey, I'd just like to stay where I'm at. Other people will call and say, hey, let me see what the changes are this year. So we do annual reviews. There's no cost for my help. We get paid by the insurance companies. We have Medicare seminars where we teach you about the Medicare and the Medicare plans. We also have Medicare webinars, which is the online version of the seminar. I have a podcast called the Medicare Minute. A lot of people call me Medicare Mark. So Medicare Mark produces the Medicare Minute. And I have a Medicare Mark membership site. And I also have a webinar called The Truth About Medicare. So here are the basics of Medicare. You have Medicare Part A, which is hospital insurance, right here. You have Medicare Part B, which is medical insurance. Those are the 2 parts that were on the Medicare card on the previous slide. There's Part A, hospital, and Part B, medical. Part A is given to you if you worked enough quarters in your life. And for those that didn't work enough quarters in their life, say they only worked 30 quarters, they would pay a different premium. So Part A is generally a 0 premium. If you didn't work enough quarters, you would have to pay around $437 every single month if you had less than 30 quarters. But most people pay 0 premium for Part A. Now Medicare Part B, medical insurance, if you're basically just turning 65 in 2019 and you're on a certain income level, for example, 85,000 as a single individual, 170,000 as a couple. If your MAGI or modified adjusted gross income is below 170,000 as a couple or 85,000 as an individual, you'll pay $135.50 for your Part B of Medicare. Now there's 5 different levels based on income, and then you would have income-related adjustments if you're above those thresholds. Then there's Medicare Part C. Medicare Part C are also called Medicare Advantage plans. They're like HMOs, PPOs, private fee-for-service, special needs plans, and basically they include Part A, Part B, and sometimes they have drug coverage. So most plans, Medicare HMOs and PPOs, they do have a drug plan included with it. Now you also have standalone Part D plans, and usually you get one of those when you have a Medicare supplement. Okay, so step 1, you decide how you want to get your coverage. So original Medicare or in a Medicare Advantage plan. So if you choose the original Medicare route, you're going to have that Medicare card. You're going to have Part A, hospitalization, and Part B, medical insurance. Step 2, you would decide if you want supplemental coverage. If you don't get supplemental coverage, you're going to have some co-payments and deductibles that you have to pay. And then you would pick up a Medicare supplement or a Medigap policy. It used to be A through J, now it's A through N, and they eliminated some of the plans in between. You can decide if, step number 3, you decide if you need drug coverage. And that would be meaning that you're paying for Medicare supplement a certain premium based on the state you live in and the area you live on, and you would have to pick up a drug plan at additional premium to cover your drugs. Now, or if you picked a Medicare Advantage plan, which is called Part C of Medicare, like an HMO or PPO, Part C combines Part A and Part B, and usually Part D. Step 2 of that route is you decide if you need to add drug coverage. Part D prescription drug coverage. Most Medicare Advantage plans cover prescription drugs. You may be able to add drug coverage in some plan types, if not already included. So original Part A, you're eligible at age 65. There's no cost for Part A as long as you have worked 10 years or 40 quarters. It works with any hospital that accepts Medicare nationwide. Your Medicare benefits will restart after you're out of the hospital for 60 consecutive days. And once you've used all your lifetime reserve days, then they'll never be offered again. So Medicare covers 90 days of inpatient hospital care. So if you're on just a Medicare card and you get nothing else, you do not purchase a Medicare supplement. If you just have that red, white, and blue Medicare card with Part A and Part B, and you need to go to the hospital, the first 60 days, you have a Part A hospital deductible, and that is $1,364. So if you're in there for those first 60 days, that's what you're going to have to pay. Well, if your hospital stay is longer, days 61 through 90, it will cost you $341 every day, or for those 30 days, $10,230, along with the $1,364. And now for the 90-day hospital stay, you're up to $11,594. After the 90-day hospital stay, you have a pool of 60 lifetime reserve days you may use. So let's say you have a longer stay in the hospital and you're using all 60 of those lifetime reserve days. You'll owe $682 each day, or $40,920, plus what you had already paid for the 90 days, which means for the 150-day hospital stay, it will cost you, with your Medicare card, $52,514. There's also no maximum out-of-pocket or cap with original Medicare. So original Medicare Part B coverage. You're eligible at age 65, but can delay if you're continuing to work. Premiums start at $135.50 a month, but could be higher depending on your income, and then you get an income-related adjustment. It works with any doctor facility that accepts Medicare nationwide. The Part B deductible, which is the medical deductible, is paid annually and may change each year. The Part B deductible for 2019, and you must pay this before Medicare pays, is $185. After you have paid the Part B deductible, and all you have, remember, is the Medicare card, no other insurance, Medicare pays $80, and you would have to pay 20%. So you're paying the first $185, and then you're paying 20% of everything after that. If a doctor does not accept assignment, the doctor may charge you an excess charge, and that's 15% above the Medicare assignment. So you'll also be liable for that. There's no maximum out-of-pocket or caps with the original Medicare. So when you purchase a Medicare when you get on Medicare Part A and Part B, most people will purchase either Medicare supplement or Medicare Advantage plan. Let's say we're talking about the Medicare supplements or Medigap. Some important factors to know. You must have Part A and Part B of Medicare. That's that red, white, and blue card. You pay a monthly premium for your Medigap policy in addition to your Part B premium. So you're probably not paying for Part A. You're paying the $135.50 for Part B at least, and then whatever the premium is of where you live and for what plan you choose. That's called a Medigap policy, or some people might call that a supplemental policy. And it cannot include prescription drug coverage. Costs vary by company, and policy may go up as you get older. So now there's guaranteed coverage. When you turn 65 or first enroll in Medicare Part B, you have 6 months to choose a Medicare supplement plan without answering any health questions. After those 6 months, insurers can ask health questions and can deny your application if they wish. You also have choice of doctors and hospitals. accept any doctor or hospital facility that accepts Medicare nationwide, and there's standardized coverage. So the insurance companies can sell you a standardized policy identified in most states by letters A, B, C, D, G, L, M, and N. This means that different companies can charge different premiums for the exact same policy. So they're standardized. They're exactly alike, except for the company and the premium. So Plan F also offers what's called a high deductible plan. If you choose this option, this means that you must pay for Medicare covered costs up to $2,200 in 2017 before your Medigap plan pays anything. And Plan N, it pays 100% of the Part B coinsurance, except for a copayment up to $20 for some office visits and up to $50 copayment for emergency room visits that don't result in an inpatient admission. So you definitely need to get with an independent insurance rep to help you understand all your choices. Now here's an example. There might be a Plan F Medicare supplement, a Plan G, and a Plan N. These percentages are the annual increase. So Plan F is actually the guaranteed issue policy. In other words, let's say a company goes out of business and all of a sudden people don't have insurance. They're entitled to guaranteed issue policy. And Plan F is that policy. So because Plan F is going to receive people every year because of some reason, the guaranteed issue policy, they're going to get unhealthy people in the risk pool. So there's a higher annual increase in the premium on Plan F. So a lot of people think Plan F is the best plan to choose. It's not necessarily the best plan to choose because Plan G might have a lower renewal rate and a smaller premium. And there's also Plan F. So this is something we'll go over individually, and that's how we help you choose the right plan. We have to know enough information about you, where you live, and what you're looking for, and then we guide you on the best plan choice when you're choosing a Medicare supplement. Okay, so here's an example. Inside the Medicare supplement books, they'll give you an example like this. Medicare Part A, the hospital services per benefit period. A benefit period begins on the first day you receive services at an inpatient in a hospital and ends after you've been out of the hospital and have not received skilled care in any other facility for 60 days in a row. So your benefit period starts right when you receive services and doesn't end until 60 days after you stop using those services. So if you went back in on day 50, you're still considered in that same benefit period. So for hospitalization over here, that's that Part A benefit. The first 60 days, you're going to pay everything. Medicare is going to pay everything but your deductible, the $1,364. Okay, now if you had Plan G would pick up that Part A deductible and you'd pay $0. But if you didn't have Plan G, you would pay that $1,364. For days 61 through 90, you pay all but $341 per day. And if you had Plan G, you would pay $341 per day and you'd pay $0. Days 90 thereafter, while using 60 lifetime reserve days, Medicare pay all but $682 a day for those 60 days. So $682 a day is what the plan pays if you had Plan G, and you'd pay $0. So now you have an additional 365 days. Medicare pays $0. The plan pays 100% of Medicare eligible expenses. You pay nothing. And beyond the additional 365 days, you would pay all costs. So once again, here's the skilled nursing facility care. You must meet Medicare requirements, including have been hospitalized for at least 3 days and entered a Medicare approved facility within 30 days of leaving the hospital. And then Medicare would pay all approved amounts, all but the $170.50 a day. Okay, so that would be Medicare pay the first 20 days, and then the next 80 days of the 100 days, you would pay, or the plan would pay $170.50 if you had Plan G, $170.50 a day for days 21 through 100, which is 80 days if you had Plan G, but if not, you'd be paying that. It also pays for the first 3 pints of blood, and then it'll pay for some hospice care. So on the medical expense side, this is the Part B side. You can see there's a $185 deductible you would have to pay, but Plan G would pick up that the Plan G wouldn't pick up that deductible. Plan F would. So on Plan G, you pay $185. On Plan F, you wouldn't pay for that. So these are things that we would go over in person, but this is just showing you what Plan G would cover. So When you're looking at Medicare supplements or Medigap policies, basically, how do you compare? Plan G is just like all apples. Since they're standardized, Plan G with every single company is the exact same plan. You just have Plan G Company 1, and it has this premium. Plan G Company 2 has this premium. Plan G Company 3 has 126. Plan G Company 4 has 149. Plan G Company 5 has 173. So in this scenario, since you're comparing apples to apples, most people will, as long as the company's a good, strong company, would pick $106 premium a month for that Medigap policy. So you're comparing apples to apples. Now, on the Medicare Part C or Medicare Advantage plan, how do you compare? Basically, Medicare Advantage plans, they're not standardized. They have to offer similar benefits. They have to cover everything that Medicare covers. And sometimes they throw in additional benefits like dental, vision, hearing, gym memberships, stuff like that. But you're going to look at one company, and they're going to say, hey, the premium is $20. Plan 2 might be $0. Plan 3 might be $98. Depending on what plan you pick, there might be a premium. In a lot of areas, there's actually zero premium. Then you're just comparing benefits. What kind of doctors networks do they have? The drug formularies that are built in. All formularies can be different. Copays and out-of-pocket limits, they can all have different copays and different out-of-pocket limits. But remember, there is no limit on Medicare supplements and just plain old Medicare. Inside a Medicare Advantage plan, they're going to limit how much you can pay every year. They call that a maximum out-of-pocket. And the plans can change every year. So every year you meet with us and we see what the plans are. So on Medicare Advantage, you can save some money, but you would probably have to use a doctor in a network, or if you go out of network, it would still be a little bit cheaper, but you would still be using, or in other words, Medicare is going to be paying the companies to take care of you, where in the other system, you're paying a premium for supplement. And once Medicare approves their 80% and pays it, then your supplement then pays the 20%. So Part D, prescription drug benefits, important facts. Prescription drug plans may have a monthly premium and an annual deductible. Prescription drug benefits work off a calendar year, January 1st to December 31st. And plans use a formulary. This list includes individual drugs covered by a plan. There are different tiers. Most plans place drugs into tiers or levels. Tier 1, Tier 2, Tier 3, Tier 4. Some even have Tier 5. Each tier has a different copay or coinsurance associated with it. And sometimes you need prior authorization or quantity limits. Some drugs require you to be, you or your prescriber to contact the drug plan before you can fill certain prescriptions. Your prescriber may need to show that a drug plan is medically necessary for the plan to cover it. There might be quantity limits that say how much medication you get at a time. And the last thing down here on the bottom left where my picture is says step therapy. Sometimes you might have to try one or more similar or lower cost drugs before the plan will let you have the other drug. So there might be some step therapy in that Part D plan. And remember, Part D is a standalone drug plan, but inside Part C plans, they do have drug benefits similar to the Part D plan, but it's included in the Medicare Advantage Part C plan. So here are some important enrollment dates. So on a Medicare supplement or Medigap policy, basically 6 months before your Part B effective date, most carriers will let you lock in a price for your Medicare supplement up to 6 months before the Part B effective date. Once your 6-month open enrollment period ends, you may have to answer health questions. This means you could pay higher premiums or be denied for coverage if you choose to enroll after your effective date. So important enrollment dates: original Medicare and Part D or Medicare Advantage. You can enroll 3 months before, the month of, and 3 months after. Your Part B effective date starts right here in the middle, right after the 3 months before. Original Medicare can be done online. To get your original Medicare at www.ssa.gov/Medicare. It can be done in person at the local Social Security office. If you already are receiving Social Security benefit before you turn age 65, your enrollment is automatic. You will get a Medicare card in the mail usually 3 to 5 months before your birthday. How does that happen? A lot of people choose to go on Social Security before full retirement age, which is 66. So if they started Social Security at 62, they're automatically going to receive the card that has the Part A and Part B on it. Sometimes people don't receive a card because they decided to delay Social Security, and for some people that may be a good idea. But once again, you need to get together with your independent advisor, and you need to find one that also understands how Social Security works. So here I am, Mark Lumia. My number is 800-762-7572. You can also get me at MedicareMark at MedicareMark.com, or that same number up here is 800-7-MARK-72. So 800-7-MARK-72 is exactly the same as 800-762-7572. I'm Mark Lumia, also known as Medicare Mark. I hope this Medicare 101 education helped you out a little bit. Obviously, I only covered things on the surface area. There's a lot more to cover, a lot more to learn, and we appreciate you calling us or getting in touch with us so we can help you get clear solutions to all your Medicare questions. Thank you.